Hi, how are you? How's everybody doing today? Hope you are feeling well and feeling pain-free today. Um, Today I want to talk about how medications actually works against ankylosing spondylitis. I made a video a couple of weeks ago about the type of medication that is being used to treat ankylosing spondylitis, but I never really mentioned how it works. So this video I want to cover some of the medications and how they actually works according to my own knowledge and experience that I've been using throughout all these years. So the video I talked about, the treatments, I'll link that to, I'll put a link somewhere on the video as well. So anyway, I want to get the disclaimer out. I am not a doctor, nor I am in a medical professions. So all the informations that I am talking about are purely my own knowledge, and throughout the experience of all these years, I have ankylosing spondylitis, medical treatments that have been performed on myself, and medications I've been used on myself. So if you have any medical uh, information that you need to know, please consult with your doctors for any medical advice. Thank you. So medications, when when you first develop pain, right? More generally, most of the people, I guess, when we have pain, and right off in the beginning, right off the bat, you're not no one is sure that we have ankylosing spondylitis or rheumatoid arthritis or any of the autoimmune disease. So the first thing we probably do is go to a pharmacy and probably get a couple of painkillers, Tylenol, or maybe some over-the-counter non-steroid anti-inflammatory drugs. But, pain medications like Tylenol, um, I found that it really doesn't do too well against arthritis, uh, and not to mention ankylosing spondylitis, even just regular arthritis pain. I don't find that it actually helps much. There is a version of Tylenol for arthritis. It that might would I believe that's the maximum strength. That might works a little, um, but I don't really find Tylenol actually work too well for for pains. But they work great for fevers. I actually use them if I do have a fever, and that works. But for pain, not so much. Now, there are a much stronger type of painkiller medications that are opioids, and I believe we hear it all the time now that we have an opioid crisis where probably people are abusing these medications and use it illegally. But the legal part uh, of this medication is what we use it is these medications actually are very strong. Um, they are the opioids has the substance of the heroin within these medication that can trigger the brain to cut off these pain receptacles. So taking these medication does work for pain, but they are very strong. Um, they are made from the opium poppy trees. So you got to treat these medications. These are control medications, and they do really work for me. To be honest with you, I was in the days when I was experiencing a great deals of pain. I was popping these like candies. Now, when I say popping these like candies, I'm not abusing these like people who use it to get high, but I'm taking a lot of these within the maximum limit, of course. Like Vicodin, I was actually taking quite a bit of Vicodin. Probably I want to say uh, 2.5 pills, or I don't remember. I believe you can take up to 3 pills of Vicodin. But what I like to do is I actually break it into half, and I take half of them at at a time, and it actually lasts me longer. Instead of taking the whole full pill, let's just say if one pill can last me for 6 hours, but if I break it apart, I take half of the pill, it'll last me for 4 hours, and then I'll take the next half, it'll get me another 4 hours. So in total, I get better result with taking just half the pill at one time. So yeah, in the old days when my hip pains, my spine pains was developing, it's very painful. So I was taking these pain medications. They really help, but it's got to be in a controlled environment. And then on the later days, my doctor switched me over to Tylenol with codeine. It's very much the same. It has the same heroin substance within the codeine, but it's just the Tylenol versus the Vicodin. And medications they use in the hospital like morphines, oxycodones. These are the type of medication, opioids, that can really treat the pain, but is not something that you want to be abused, and hopefully not something you want to take it on a long-term basis. And in particular, do not drink alcohol with these. Luckily, I am not a drinker. Like I said, I was popping these pills like crazy. I don't drink, to be honest. Maybe I have a little tiny bit here and there, but I was never a drinker. So that's a good thing. I'm still alive, probably because of that. The next medication I want to talk about is non-steroid anti-inflammatory drugs. Um, these drugs are basically, according to what I know, is really the first line of treatment. And I remember when my doctor started giving me these in the old days, I believe was Niprosin, Voltaren, if I remember it correctly. So these are pretty old medications. These medications can reduce inflammations. The one over the counter, if in the earlier stage when we start having pain, um, over the counter with things like Advil and ibuprofen, they they do a small number of jobs that can treat very minor pains, but when it gets to moderate and severe pains, those will not work. Um, the better, more stronger pills like 9% actually worked in the early stage when I started having pain, um, and then probably got to some medications like Mobex, Baxtra, and I believe Baxtra has already pulled off the market for that. Mobex, um, Mobex actually works well. In the days when I would start having a lot of pain. I was taking Mobex before I started on the much stronger medication. It worked well, um, but the problem with the non-steroid anti-inflammatory drugs are uh, they cause a stomach issue, and doesn't matter really what I take. Over the years, it developed a acid reflux and other stuff that can it can also cause stomach bleeding. So I'm constantly taking the acid reflux medication, the PPIs, and the H2 blockers. So I was taking those for years, and then on the later days between insurance issues, um, I was put on Celebrex. Celebrex actually is a good medication. It works well for me. It's also a non-steroidal anti-inflammatory drug. These medication does reduce the inflammations, and by doing so, the pain level actually gets a little lower. And I think just Celebrex by itself worked out for me for quite a few years. However, Ankylosing spondylitis is an autoimmune condition. The non-steroidal anti-inflammatory drugs, it can reduce the inflammations on the joints or wherever your pain is, wherever the inflammation is happening. It can reduce those inflammations. However, it does not slow down the progressions because the autoimmune system, your overactive immune system is where the problem is. It's attacking your own tissues. So uh, it's to prevent pain, but not to slow down or stop the autoimmune progression. So these are the type of medication that can help you with pain only. Now, the next medications that I actually use are steroids. Steroids are, to me, is actually a great medication. You just cannot take it for a long period of time. Um, Prednisone, probably most common. It can be used pretty much for many purpose. I know I taken prednisone for my arthritis, rheumatoid arthritis, when the early days when my doctor thinks it's actually rheumatoid rather than ankylosing spondylitis. Um, I'm still taking prednisones here and there actually, but not the pill form at the moment. I have prednisone eye drops for uveitis, and that's also another autoimmune condition. So I got prednisone eye drops to reduce the inflammation, and like I said, steroids are really good medication. It can help you reduce the inflammation much better than non-steroid anti-inflammatory drug. However, you just cannot take these in a long period of time. Um, I got fat because of the prednisone because the more you take, the body just felt like I just want to eat. I don't know when I'm full. I just keep on eating and eating and eating. I gained quite a bit of weight in the old days. But once I stopped the prednisone, the weight kind of slowly comes down. But it's kind of hard to take off the weight. It's easier to add weights. So yeah, prednisone normally when doctors give that to you, they kind of give it to. I was on maybe like a 2 week to 3 week basis, and then the doctor will stop it for a while, and then I think he picked it up again after a few weeks. So over the few months period, it's 2 weeks or 3 weeks, and then 2 weeks off, and then picks it up from there. It has to be gradually taken from small dose to a higher dose, and then tapering off from a higher dose to a smaller dose. It cannot just be dropped like that. Um, Also, my orthopedic surgeon in the days where he was giving me steroid shots directly into my spine. Um, One shot into three different sections. So, the top, the middle, and the lower part. Uh, my goodness, these medication work like wonders. I felt like a a new person for one good week, maybe about 5 days. But yeah, within that week, I was pretty pain free. When my spine was started to fuse, I was under so much pain that I cannot get out of bed. But when I go see him, he gives me a shot into three areas of the back. Wow, it works within I think within the same day. My pain slowly gone away, and I was just moving freely um, for, like I said, 5 to 7 days, and then the pain starts coming back. Again, it doesn't really stop the progression of the autoimmune condition, unfortunately. And like I said, unfortunately, you cannot take it for a long period of time. It's actually a good drug, but it has to be controlled as well. And then there are the disease modifying drugs like methotrexate and and other medications. I was put on methotrexate for a while. These are also considered the older biologics. These are immunosuppressant. It can suppress your immune system, and it can slow down your progression. Reduces the your overactive immune system, so it doesn't attack more of the tissues. But it doesn't really work for everybody. I don't believe it actually worked for me. That's why I wasn't on it for too long. I was on it for I think just a month or so. Didn't really do much for me. So my doctor took me off of the methotrexate. Um, yeah. So again, these methotrexate can help reduce inflammation. It also can suppress the immune system. It's really the purpose of. It's actually really made for cancer treatments. So, but on a lower dose, I read up that on a lower dose, it's effective against some type of rheumatoid, mainly rheumatoid arthritis. Not so much for ankylosing spondylitis. Maybe that's why it didn't work so well on me. Um, Also, with other inflammatory bowel disease, methotrexate would work great. But again, it didn't really work for me. In my case, it might work with some of the other conditions. Probably uveitis will work. One of my eye doctors wants me to put to add methotrexate to my medicines, but I kind of held off, and I wanted to just kind of make some diet change to see if I can lower my inflammation a little bit. Also, the problem is with these medications is they're actually quite toxic, so you got to watch out for livers, and other kidney conditions. So methotrexate it doesn't work too well with people who has these conditions. I do have kidney stones, so I'm a little bit reluctant to take it. So I put that off. Now the main medications I really want to talk about is biologics. Biologics currently there are five FDA approved biologics, where it's embryo, Simponi, Humira, Remicade, and Cimzia. I'm currently on Cimzia. I used to be on Remicade until I developed a reaction. I was on Remicade for about probably 7, 8 years. And then right now I'm on Cimzia for roughly maybe about going to 7 years already, and they work just fine, perfectly. Um, I also tried Humira. Humira did not work for me. Um, I actually probably had a reaction to Humira. So these medications will strictly work on the immune system, and that's where the targeted treatment should be for ankylosing spondylitis or rheumatoid or any other autoimmune conditions. The it's the it's our autoimmune system that is overactive, and it's attacking our own tissues. So by lowering these our own immune system to a certain point where it can slow down the progression, or maybe even stop the progression, depending on each individual. Um, I want to say, in my condition, I probably have a way overactive immune system. And when I'm on these biologics, I suppress it down to maybe just slightly above the normal range. So it slows down my progression, but it did not stop my progression. But I heard, from some people, it actually can pretty much kind of stop their progressions. And like right now, I am pretty much in a good shape. But over the last couple of decades, even if I'm on biologics, gradually, it have done a great deal of damages to my bones, and I'll talk about that in just a second. Um, so it does slow down the progression, um, but it doesn't really stop it. For some people, it can put them into remission. So when that's the case, yeah, you're in good shape. It stop attacking your own tissues. Yeah, so the positive effect on these medications, it actually works very well. It suppresses the immune system. Um, Not all the medication will work for everybody. And I have seen that throughout these Facebook groups and Reddits and talking to other people. Um, One medication might work for one person, might not work for the other. Like I said, Humira did not work for me. Humira works great for other people. Um, I've seen other people have very great results. But Simcia worked for me very well. Remicade worked for me. I did develop a reaction towards the end of the 6 or 7 years treatment, and then I gotta I gotta be taken off of it because the if I keep going, reaction might get worse. So the doctor switched over to Humira. Actually switched over to Orencia, another type of um, biologics, but it's not to treat ankylosing spondylitis. I was on it for 3 months and have no effect whatsoever. Embryo. That's the doctor started me on that in the beginning. I didn't have any luck with that medication, and then switched over to Remicade. Remicade worked. It probably took away most of my pains. So, while I'm at it, I might just talk about that as well. Um, Depending on the damages to your bone, for me, uh, even when I'm on biologics, it slows down the progression only. So it continued. It, the 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 inflammations, the autoimmune still attacking my tissues and still destroying my joints continues, but it just slows down to a certain level. Um, so just biologics itself didn't really do the thing for me. I also needed some pain medication. That's why I was also on Vicodin as well as other the Tylenol with codeines in the old days. I was taking biologics, and I was taking Vicodins as well, because the spine fusion, it's it's very painful. So with biologics and the pain medications both together, um, it does help. It lowered my pain level to say a 10 to maybe a 4. So it could not completely reduces the pain, but without it, I would probably be in an 8 or 9 at all times. That's how painful it is. I was having a hard time getting out of bed because of my spine. Now, the negative part about the biologics, as I actually mentioned earlier, um, it continues to attack your tissues if it doesn't stop the progression. It only slows it down. But however, these medications are generally the last lines of treatment. So yeah, doctors will give you these medications where all others fail, like the non-steroid anti-inflammatories or steroids. When those medications fail, then the last line will be on biologics. But by then, in my case, um, I think I was already in pain for about 10 years in, 10 to 12 years in. Um, all I can say is my hips was the first to go. So it was the first to start the pain and the first to go. So um, biologics can lower your immune system, and therefore it slows down the progression or probably stops the progression. However, whatever the damage that's already been done, it's been done prior to starting the biologics. Biologic cannot repair the damages. So let's say in my case is my hips for the 10, 12 years already. I was in so bad of a shape. My bones already deformed, and I cannot stand on my hips. I cannot stand up. It was so painful. You cannot move the joints. So even if I'm on biologics, um, that those damages are not reversible. So what I actually end up doing is I actually end up getting uh, a hip replacement. Sorry, kind of got blanked a little. So I had both of my hips replaced. Um, yeah, and there was no option. It was just so badly damaged for the first previous 10 years before I started biologics. Now I wish that there's some tests or whatever it is that probably nowadays I didn't have those tests yet, but they can test for the genes or the inflammation rate. But still, it's kind of hard for doctors to say, "Oh, you have ankylosing spondylitis right off the bat," right? So I mean, I wish that for me, I wish I started on these medications 10 years ago, prior to my replacement. Then I could probably save my hips. But yeah, and unfortunately, these are the last line of medications. But it is targeting the immune system, so it suppresses it to a point that where some people their arthritis will go into remission, and that's a good part, and that will probably save a lot of damages to the person's body. So again, unfortunately, these are the last lines, and these are the negative side of these medications. And if just biologics itself cannot reduces the pain, you probably need some other pain medications alongside with it to help reduce the pain. The damage has already been done. So I forgot to mention that these biologics are very expensive. Without medical insurance, it's kind of tough for anyone to be able to pay for these medications. However, there are some newer, it's called a biosimilar, very similar to these biologics, slightly a little bit cheaper, but still expensive. Biologics can also increase the risk of tuberculosis, TB. That's why whenever doctor starts on anybody on biologics, they will make sure they test you for TB before they put you on here. If you're positive, and make sure the doctors will make sure you get treatments before getting on biologics. So I talked about the five FDA approved biologics right now. There are other type of inhibitors. There are also biologics. The IO-17 inhibitors, the JAK inhibitor. There's a lot more medication on the pipeline now than what I had when I started. So the future is actually looking very bright for people with ankylosing spondylitis. Although currently, what Simcia and just Sunset itself is working out for me very well. So, but there's a lot more. So, just in case someday Simcia stops working, I still have hopes that there are other medications out there that will work. So don't lose hope. There's plenty of medications coming out. Um, science continues on researching on these. So, there are medications for everybody. Hopefully, once you get the right treatment, you can pretty much get your life back. So don't lose hope on that. So I want to just kind of show a little chart about my my blood test recently, and for me, just being on Simcia, uh, currently right now, like my sit rate, the sit rate can tell how much pain you have and how much inflammation you have. And if your sit rate is high in the old days, God, my God, when my back had started fusing, my hip was in pain. My sit rate is off the chart. Right now, it's within the range, 6. Um, I believe the range is smaller than 15. Anywhere, I used to be probably in the 30s or even higher. So I was in a great deal of pain. White blood cell. White blood cell also in a normal range. So whenever your blood cell, when my blood cell is white blood cell is high, there's a great deals of inflammation in the body, great deals of pain. It's all it means there's something wrong. So I guess the white blood cell is the body's agent to try to fight these diseases and conditions, regardless if it's inflammations or a virus or bacteria. White blood cell can be high. So, but right now, everything seems to be good. That's a good thing. That's all for this video. I just want to share a little bit of information from the many decades of treatments and the medications that I've been taking over the times with everybody. Hopefully, this is a little helpful to some people. Unfortunately, I am not a medical professional, so please take these information with a grain of salt. If you want to understand more about these medications and how they work, please consult that with your doctor. Seek treatments with them. They can help you out. They can guide you to the right medical treatment, the right medications, and hopefully they can give you a better knowledge of what these medications does. So if anybody else have any inputs to these medications, what are your thoughts? What do you think about my little knowledge? If you want to share your thoughts, please do so. I'd love to hear from you so we can all find these better days together. Love to hear from you. Love to learn from you as well. Thank you for watching. If you like my video, please give me a like. If you want to subscribe, please do so. I have more videos coming out. So I will see you on the next one. Thank you. Bye-bye.